if the purpose of a conversion symptom is to hide the memories in the body, how do those then become survival resources? Now, Judy Herman, and I was so blessed to have a year of individual supervision with her in 1992, the year her book came out. She wrote something in that book that is as true today as it was then. We probably even understand it better. When neither resistance nor escape is possible, the human system of self-defense becomes overwhelmed and disorganized. Each component of the ordinary response to danger, having lost its utility, tends to persist in an altered and exaggerated state long after the actual danger is over. Right? So that is very important. We are born with the same animal defense responses as any other mammal. When we can't use them, they persist in an altered and exaggerated form. That idea that our animal defense responses continue to reactivate in this altered and exaggerated form is at the basis of the structural dissociation model, which is actually not a dissociative disorders model. It is a trauma model being used throughout Europe, developed by Anno van der Hart and Ellert Nijenhuis in the Netherlands, Kathy Steele from the United States. And the hypothesis, the theoretical basis for this model, says that we structurally dissociate the defensive responses and the implicit memories. You know, old models of dissociation focused on DID, dissociating memories and time periods. This model says trauma, by its very nature, causes us to fragment and to compartmentalize such that some part of our personality, some aspect of ourselves can go on with normal life. Any therapist who has been through a personal loss, crisis, will attest to the fact that we all have that going on with normal life part, and that even on days we think we can't possibly show up for our clients or our children, right, or our families, somehow we do. So the theory says that under traumatic conditions, part of us remains on guard, hypervigilant, ready to flee, fight, freeze, submit, or cry for help, while part of us keeps on keeping on. Now, this is brilliant because it means that the side of us that's keeping on doesn't have to have any relationship to the trauma. If we add to that somaticizing of memory, it becomes even easier. No wonder these clients were such high-functioning women. Now, the theory of structural dissociation says that we split not along metaphorical lines, but along the lines of the left brain and right brain. The left brain part of us carries on with normal life no matter what happens, while a right brain part of us holds the traumatic memories and survival responses. Right? Perfect. It's there at birth, that split between right brain and left brain. What the theory goes on to say is that with chronic conditions, you ever met a client who had only one single incident trauma in childhood? In 33 years, I've met one. So for most children, trauma is, in Karen Sackvitney's words, it's a set of enduring conditions. It isn't even just a series of events. It's a set of enduring conditions, the result of which is that this right brain part of the personality starts to fragment, or subdivide along the lines of the animal defense responses that we need to save ourselves. The attachment cry part holds the cry for help response. Anyone who's been around small children knows that that cry response is the very first animal defense children have, and they use it. And we as parents hopefully respond, right? We hear that cry and our bodies immediately mobilize. Hopefully we mobilize the apparently normal part of us. The submission response, right, becomes encapsulated as another part of the personality. The freeze or fear response as another. The flight response as another, and the fight response.